Again, ma'am, good morning. So, ma'am, how's your day?
I'm good.
Okay, so, by the way, ma'am, I am Doreen Gratz El Agom, your nurse student for today. So, ma'am, before I will start the examination, I will explain to you the purpose of this. So, the purpose of this is a method of palpating the abdomen, wherein the fetal presentation and live position are determined. Can you please empty your bladder? And then I will put some drape to ensure the patient's privacy. So, this is to prevent the uncomfortable feeling. Uterus is easier to palpate in an empty bladder. Next is, I will proceed to the Leopold's number 2. Okay, ma'am. I will use this stethoscope to see the heartbeat, or to hear. Next is I will perform the Leopold's number 3. Okay. Next, I'll perform the Leopold's number 4. Okay.